Good to have you with us. You're watching Mirror Now. This is the big story. I'm Avni Raja, and our focus today is on the COVID situation across the country, which is slowly becoming more and more serious, and the second wave that we are in. And we are facing a second COVID wave across the country. Around 68,000 odd cases have been reported in the last 24 hours. This is the highest COVID spike that we've seen in this year. In fact, fatality rate has also seen a sharp rise of around 51% during the week, which is again the highest since December. Now, a large part of the country today is celebrating Holi. The situation seems to be worsening on the COVID front, with 8 states now which are contributing nearly 85% of the total cases across the country. These include states such as Maharashtra, which of course is the worst hit. But aside from that, we're also talking about spikes being seen in states such as Madhya Pradesh, Karnataka, Tamil Nadu, Punjab, Gujarat, and even Chhattisgarh. And of course, the state government in Maharashtra, meanwhile, is mulling another lockdown, is what we understand. But let me go across to Ayushman, who's joining us for more details. Ayushman, the situation seems to be getting more and more serious day by day. Every day, we are now touching new highs as far as the COVID cases are concerned across the country that we are seeing this year. What is the sense you're getting? Because 8 states are the ones which are seeing the maximum number of cases.
Yes, Avni. In fact, if you compare it to the last time, the first surge which India had witnessed, about 97,000 was the largest number that we saw, and nearly two-half of the positivity is almost achieved, because today India has seen over 68,000 cases. Now, if you see this spike, right from February 9, the cases have been mounting up. But at the same time, you have to remember the fact that 1 year ago, today, India has merely 1,000 cases. And if you see the spike in this year's trajectory, it is far steeper as compared to that of previous years. If you see the numbers right now, it is 68,000 with only 8 states across the country. If you see the overall spike, it is somewhere in past 1 month, the number has gone 4-fold up. And currently, Avni, the state of Maharashtra is contributing to the highest caseload. But at the same time, you have Tamil Nadu, you have Madhya Pradesh, you have Punjab, you have Delhi, and there are several other states which are witnessing the upward trend. The mortality is definitely low, but the numbers are coming in a higher progression that we were witnessing in the first surge of COVID. The center has been regularly meeting upon the states to enforce the COVID appropriate behavior. But despite that, it seems the numbers are only increasing with every passing day. On February 28, Avni, last month, we had about 16,000 cases. Now, if you see it today, it is 68,000, nearly 4-fold in the rise that we have seen. At the same time, if you compare it to the previous surge, that was the first surge, even in the first surge since October, this is the highest spike that we are witnessing. It was in August, somewhere around August 16, that we saw these numbers. And currently, after witnessing for about 3 months decline, the numbers have started going up. The center says that states have been told to implement the COVID appropriate behavior. They have been told to curb on the gathering that is taking place, because the festival season is out there. But it is very important to understand that despite all those protocols and advisories, the numbers are going up. This is the second surge in middle of the pandemic where we are right now, where India has reported more than 68,000 cases in past 24 hours.
Yes, absolutely, Ayushman. Just to take that point ahead that you were talking about with regard to what the center is doing at this point in time, because we do know that states are taking, their own decisions in terms of the kind of new protocols being put in place and restrictions being imposed. But the center had also said that things like, night curfews and limited lockdowns for the weekend, for example, those things don't really work. So what is it that the center is now saying in terms of, how to battle the second wave, especially in these key states which are seeing a dramatic rise?
Well, there are 3 things which are very, very important, Avni, here, because if you see, there are there is one concern which has cropped up new. It was not there in first surge, it is there in the second surge, is that of the variant version that is being reported in Maharashtra, in Punjab, in Kerala, and also in Karnataka. So first up is the states need to up the number of testing that we are seeing. The second is the most important aspect of the entire pandemic is the contact tracing. The center has told the states that they need to track around 30 people per positive contact. So that means if Maharashtra starts quarantining people basis contacts, a large number of people will be there in contact. So contact tracing is something that the states have been told to focus upon. And the most important tool against fighting the pandemic is what we have seen, the vaccination number. The center has said that a large number of vaccinations should take place. Of course, we are just days ahead of the vaccination norm being changed. 45 years above, people can go and get themselves vaccinated without any modality. So three things are very, very important: increasing the test number, quarantining and isolating more people who are in contact with the positive cases, and the most important is the vaccination part, because center has already clarified that the night curfew, the lockdown seems to have limited effect. So it is the three strategy that the center, in fact, center has pointed out a five-point strategy day before yesterday to the states. But these are the three concerns where the states have been told to work upon if they want to break this transmission chain of COVID-19.
Yes, absolutely, Ayushman. And just one point to add to what you were talking about, the vaccination drive. It is being ramped up and people must go out and get vaccinated, but not let guards down even after you've received the vaccine shot. Because remember, people have to take 2 doses of the vaccine shot, and then after that, after a certain amount of time, is when the effect of the vaccine actually kicks in. So just because you've taken the vaccine doesn't immediately make you immune from getting the disease. Ayushman, thank you so much for joining us with all of those details. But let me now focus a little bit on the state of Maharashtra, which is the worst hit right now amidst the second wave that we are seeing across states. In fact, more than half the number of cases being reported across India are coming from Maharashtra. So we're talking about 40,000 odd cases that are being seen in the last 24 hours. And out of that, nearly 7,000 cases coming from Mumbai. Now, Chief Minister of Maharashtra, Uddhav Thackeray, has asked the health officials in the state to prepare a plan to make the rules stricter, to perhaps bring back a lockdown-like situation. So that plan is in place, but when and how it is going to be implemented, still no clarity on that. Let me, in fact, go across to Santia, who's joining us for more details at this point in time. Santia, Maharashtra, of course, being the worst-hit state at this point, there are already new curbs that have come in, at least during the night, but more curbs could be in store, is what we understand.
Yes, absolutely, Avnisi. That's what the meeting was actually all about. The meeting which took place, which was called by the CM yesterday, an emergency meeting. So, in upcoming days, a new set of guidelines, a new set of restrictions can be seen in Maharashtra. In fact, it was day before yesterday that under mission begin again, some new guidelines were imposed, some new restrictions were imposed in the state. And talking about where exactly the state actually falls short, our colleague Ayushman was right now talking about contract tracing. So that was one thing, because it was in the month of February, by second week, that that it was realized by, and that was the same thing which was realized by the center committee as well. And the experts, health experts in Maharashtra also felt the same thing, that contact tracing, which actually took place in remote areas in Maharashtra and in smaller districts, actually contributed to this spike. So yes, in yesterday's meeting, all that was discussed. In fact, another thing which was discussed in yesterday's meeting, that institutional isolation is something which should be encouraged now. Though day before yesterday's guidelines did mention that home isolation will be allowed with proper home quarantine stamps, and the family members also not getting out and everything. But in yesterday's meeting, it was discussed that how isolation institutionally is something which is going to be more helpful. Apart from that, clear indications were given via that meeting that the state might be actually heading towards another lockdown. But one thing which was kept in mind, that even if that happens, economic cycle is something, Avni, which should not get impacted this time, Avni.
Yes, absolutely, Santia. That, of course, is important, but also important to keep reiterating that people should not let their guards down at this point in time. Thank you so much for joining us with all of those details, Santia. Let's also now move to Punjab, which is the other state which is seeing a significant surge in cases. Punjab recorded nearly 3,000 new COVID cases in the last 24 hours. Now, Jalandhar reported the maximum number of cases with about 489, followed by Ludhiana and then Amritsar. About 7 lakh odd people have been vaccinated so far in Punjab. Let me go across to Gurpreet, who's joining us for more details. Gurpreet, Punjab is worrisome, of course, with respect to the number of cases which are rising there, but also specifically the mortality rate in Punjab is extremely high, and that is a big cause of concern as well.
Well, yes, of course, that if we can see the trend for the last so many days, that every day we have seen that there is an increasing trend of the death rate. The first day for the last week, we have seen that 35 deaths have been reported. And if we can see that since that day, we have seen every day the graph is going up, and now it has already reached more than 60 deaths in a day. So it's a worrisome situation, but at the same time, the Punjab government has already given a very clear-cut direction to all the deputy commissioner and SSP to implement the COVID protocol in each and every market. At the same time, in 11 districts, that all night curfew has already been imposed, and in Holi festival, they have already made it mandatory that there should not be get together. At the same time, we should follow all the protocol of the COVID to curb and to fight with this coronavirus. And let me when the tests were being conducted by the Punjab government, they have seen the UK strain has been found in a lot of samples. That was the worrisome situation. And now the state government is already on the toes to deal with this virus, that this virus should be curbed at this stage, or there should not be further spreading of the virus. All the protocols are being followed, and all the health department officials, they have already increased the testing in the affected area. And as you have already mentioned, that in Jalandhar and Hoshiarpur, the most of the NRIs, they visited these districts where they are trying to even get into details that how they are going to get the contact tracing, and they will be able to treat more and more people. At the same time, the Chief Minister of Punjab, Captain Amrinder Singh, he has already insisted on the immunization drive in these specific districts so that there should be further precaution.
All right, Gurpreet, thank you so much for joining us with all of those details. Let's also now talk about the state of Karnataka and Bengaluru urban district, which has turned out to be one of the major contributors of the spike in COVID cases across the entire state. The state has recorded around 3,000 odd cases in the last 24 hours. And of that, two-thirds of that, which is around 2,000 cases, have come from the Bengaluru urban district. And what's also adding to the spike is the carelessness that's being seen in restaurants and, people attending parties. A lot of violations as far as the COVID protocol is concerned. Let me go across to Neha, who's joining us for more details. Neha, as far as Karnataka is concerned, Bengaluru is concerned, even last time round when there were tighter restrictions, when we were in a lockdown, we did see a lot of violations happening then as well. And once again, this time what we are seeing is, despite the rise in cases, despite there being curbs, people seem to be brazenly flouting the norms.
Well, Avni, that's absolutely right. It was only on Sunday that we actually showed you how people are brazenly flouting all COVID norms, while attending these holy parties. Despite the government, actually banning all public celebration of festivals, we're still seeing how, people, in fact, haven't exactly understood the ground reality yet. And they're still, going ahead to actually attend these parties. Now, just to give you an understanding, Avni, after Maharashtra, Karnataka is, in fact, second in line to be reporting a high number of cases at about 3,000 cases per day, of which 2,000 were in Bengaluru alone. So now, as far as the restrictions are concerned over here, we did, ask the government about this as well. And they said that as of now, a lockdown would not have to be imposed. But having said that, they have in fact put in place several measures at this point in time, especially for people coming in from other states. to Bengaluru city, all of them would have to carry an RT-PCR negative certificate, apart from which, Avni, a very important or a key measure that's being taken up over here, in fact, by the civic body and the government is, in fact, actually the stamping of the hands. All those people who test positive, in fact, will actually be stamped right now, for, of course, their home quarantine. And it's only once, that their home quarantine is actually completed. This is, again, a monitoring mechanism that we're actually seeing over here in order to ensure that people do not actually, break the home quarantine, which is why they are going to be stamped and, they're going to be very strictly monitored. Apartment complexes, that is something, that's become a cause of concern over here right now for the government as well, because let's remember that there are several clusters emerging from Bengaluru right now, and, these apartment complexes have posed a cause of concern. So they're also going to be very, very strictly monitored over here by the civic body, Avni.
All right, Neha, thank you so much for joining us with all of those details. So that's the situation as far as Bengaluru and Karnataka as a whole is concerned. But let's also move on now to the pole-bound state of Tamil Nadu, which is also seeing a spike in cases. In fact, in the state has recorded a positivity rate of around 2.6%, and Chennai alone is seeing a positivity rate of as high as 5%. And political rallies, of course, being carried out in the states, and the rules and the distancing guidelines also not seeming to be followed. Those are the details as far as Tamil Nadu is concerned. In fact, Chennai is also the maximum COVID case contributor that we're talking about. And the cases, in fact, have risen fivefold as compared to last month. So those are the details as far as Tamil Nadu is concerned, and many political rallies that are also being held in the state as well. In fact, those are the latest details that we have. The positivity rate, in fact, jumping from 1.7% as of 21st March, and now we are at 2.6% in across the state of Tamil Nadu. That's the curve as far as the positivity rate itself is concerned. In terms of cases, if you were to look at, again, it has been seeing a significant rise in cases. You can see on your screens from 466 cases just about a few days ago. Now it has almost doubled to 833 cases. So the spike in cases is something that is consistent as far as Chennai goes. Cases being rising to fivefold as compared to what it was last month, and that's really the worrying factor here. Even though number of cases might not seem to be that much, the fact is that it is doubling quickly and it is rising very quickly as well. Let me in fact go across to Dr. Ravindranath, who's joining me on the phone line at this point in time. Thank you so much, Dr. Ravindranath, for joining us on Mirror Now. Your perspective in terms of the second wave that we're seeing right now, and specifically, if I can, bring up the point of Maharashtra as a state which is seeing this kind of a massive surge. What, in your view, is the reason that Maharashtra is seeing this kind of a surge compared to other states, which, and everywhere, of course, the situation is similar?
In Maharashtra, 20% cases are new variant. So in Tamil Nadu also, the cases are increasing very speedily because of lack of activity from the government side. Government is very much lethargic to contain the spread of corona in Tamil Nadu. After Diwali, the Tamil Nadu Health Ministry has told there is no chance for second wave in Tamil Nadu. So government didn't take any adequate steps to contain the spread of coronavirus. Moreover, people are also thinking normalcy has returned to Tamil Nadu. So they are not wearing masks, they are not following any preventive activities. So that only there is a spike in Tamil Nadu now.
Right. And with regard to the state of Tamil Nadu, what is the situation? Because even though number of cases don't seem as high when compared to some of the other states, but nonetheless, it is still increasing, consistently, and it has almost doubled over the last few days.
Yes, it's definitely doubled from the last 1 week. Moreover, Tamil Nadu is doing a lot of tests compared to other states. Highest tests are conducted in Tamil Nadu only. So the cases also, we are detecting more number of cases compared to other states. So we have to send the material, specimens for genome study. Then only we can find out whether new mutants have come to Tamil Nadu or not. Because now the spread is very speed. It may be due to new variant. So we have to find out that. That is very, very important. Tamil Nadu government should take up the issue also.
All right. Thank you so much, Dr. Anurag, for joining us and giving us that perspective. Well, that's the situation as far as Tamil Nadu is concerned, but it's also, a good idea now to highlight some of the important mythbusters, some of the important facts that once again need to be highlighted and reiterated as we are battling the second COVID wave at this point. So let's look at some of these myths and understand what the facts are. So the first myth that we're talking about is whether hydroxychloroquine prevents COVID. The fact is that it does not prevent illness or death from COVID. So that is something to remember. The second point here is vitamin and mineral supplements can cure COVID. That is again not true at all. They can boost your immune system, which might help you battle the disease if you do get it, but it does not help cure COVID. The other point to remember here is that whether masks can be worn during exercising. The idea is not to wear masks during exercising because it can affect the ability to breathe comfortably. Another important myth here that we're talking about is that the COVID virus transmits through water. Water or swimming does not transmit the COVID virus. So that is something to keep in mind and something important to keep in mind. And finally, prolonged use of medical masks is dangerous. This is another myth that people tend to get confused about. The fact is, if you wear your mask properly, medical masks don't cause carbon dioxide intoxication nor oxygen deficiency. So it is very important to keep wearing your masks, especially when you're interacting with others or you are out. It is the biggest way to help protect you from the coronavirus. Breaking news that's coming in. The Kerala High Court has stayed the Election Commission's order which halted state government decision to distribute rice to blue and white card holders. So this is a row that had broken out over the distribution of food kits, and the High Court has stayed the Election Commission's order. Remember, the Election Commission had stopped food distribution scheme, and now the High Court has stayed the order. In fact, this comes as a relief here for the Kerala government, relief for in fact, P. Vijayan. Those are the latest details coming in. The government, in fact, had decided to distribute 10 kgs of rice at 15 rupees on a priority basis. In fact, the state government then informed court that it was a routine procedure and that the scheme was already declared in the state budget. So essentially, there was no reason for the Election Commission to actually block the scheme, but in fact, let me go across to Vivek for more details. Vivek, if you can take us through, what the court said and on what basis did the Election Commission actually block the scheme? Because this is something that was, declared in the state budget, and it wasn't a new scheme that was declared after the Model Code of Conduct came into play.
Exactly. The Kerala High Court has clearly stated the Election Commission decision to stop, the distribution of free kit. That is 10 kgs of rice at rupees 15 per person. What the Kerala High Court says is that the government cannot just stop the supply of food to the common man, to the poor people, especially the marginalized section. Remember, 3 days back, Ramesh Chanitala, the opposition leader of Kerala, senior Congress leader, has written to the Election Commission saying that the LDF government ahead of the assembly elections are using this as a poll campaigning, are using this as part of their campaigning, and hence it is a violation of the code of conduct. Now, to which the government has stated in the Kerala High Court that this was already been declared in the Kerala budget, and also this is a normal affair of things where the government, in the end of every month, has been, distributing the food kits. And now this scheme has started in 2020, in the month of April, where the state government has been distributing food kits to the people, especially to the card holders, the violet and the red card holders, to which the government says that it is their duty to ensure that the food kits reach the person who are eligible to it. But to this, the state, the opposition leader, has written a letter, and the Election Commission has stayed this. Now, opposing the stay, the government approached the Kerala High Court, and the Kerala High Court has clearly said, they clearly stayed the Election Commission decision and said that the government can distribute the food kit. In the meantime, the Kerala High Court has also clearly mentioned that this cannot be used as an election propaganda or in any part of the campaign. This particular distribution of food kits cannot be used to boo the voters. Now, this is exactly what the opposition leader has been saying. Remember, this has also become a major bone of contention, a major issue between the state government and the opposition, especially the Congress party, which has raised it. The chief minister had lashed out at the opposition leader, saying that the opposition is trying to, stop the food materials that are supposed to reach the poor people. And this is exactly what the Kerala High Court has intervened in.
Right. All right, Vivek, thank you so much for joining us with all of those details. On that note, it's time to wrap up this edition of The Big Story. Thanks so much for watching, but stay tuned to Mirana. We'll be back with all the top headlines.